Okay, so this is going to be our sixth session for the DRA here. We have the same person, same demo, same client that's been nice enough to come in for us to do this. Just as a reminder, our first session when she came in, above the belly button, we had a 3.5 split DRA between her rectus abdominis bellies. And then at the belly button, same thing, 3.5. And then below the belly button, a 3.5 as well. We did 4 sessions of visceral manipulation to the jejunal-ileum, or the small intestines, if you will. And after those 4 sessions, we ended up with a 2-finger width split above the belly button, a 1-finger width split at the belly button, and a 0 below, okay, which is pretty good. This split above the belly button was not budging after, I think it was like the first or second session of the jejunal-ileum manipulation. It was being pretty stubborn. So the last session, her 5th session, we went ahead and treated leg 1 of the duodenum, or what we call D1. So just a reminder, the duodenum is the tube right after the stomach. And again, our hypothesis is we're really dealing with the posterior parietal peritoneum, or the balloon, right? The balloon that most of our organs sit into, and kind of where that D1 kind of sticks into the balloon. And so we're still thinking it's that back wall of the parietal peritoneum that's getting restricted with these things. And that's why the jejunal-ileum works, and that's why treating D1 works. So our 5th visit, which was our last visit, we went through exactly the anatomy and all that stuff. So if you missed that, go back to the 5th visit so you can see the props and exactly what I'm talking about. But in that session, when we treated D1 of the duodenum, or first leg of the duodenum, it went from a 2-finger width split to a 1. Okay, so after the last session, we were at a 1-finger width split, a 1-finger width split, which I'm saying that's going to be normal for her, because again, the umbilical cord came in here for her when she was in the womb. This is a 1 or a 1.5 for everybody out there. So don't expect that to be to a 0, and try to make sure your patients or clients realize that's not going to go to a 0. A 1 to 1.5 is pretty normal, and then a 0 here. So we were at 1, 1, and 0 on her last session. So I haven't checked her yet. So we'll see if this is closed a little bit more, or did it reopen? Did it stay the same? Are these still stable at 1 and 0? Okay, so we'll do the testing first. Again, you can test anywhere from the xiphoid process up here to our umbilicus, and from the umbilicus down to the pubic bone, anywhere along there. For me, just so I do the same thing every time, and because I find, especially for women, most of the split is in this area around the umbilicus or the belly button, so I kind of like to measure in that area. So for me, I'm going to put my ring finger on her belly button and relax my hands. And basically where my index finger comes, that's going to be my first spot that we test. Okay? So I just put my fingers across here. I'm going to tell you, this feels tighter than it did on her last session. Like, I can't sink as much as I did before, so we'll see. So go ahead and lift your head up for me. Beautiful. Okay, so she's still at a 1. Okay, it's still this kind of roomy 1, and it's really shallow. I don't know if you guys can see that or not. So I'm hitting a rectus belly at rectus belly. It's definitely not a 2, because the rectus belly is right here on either side. Okay, so we're still at a 1 and a very shallow 1. Go ahead and go back down. So that has stayed. It didn't come together anymore. It stayed what it was the last time we treated it, which is great. That's fine. We come down to the belly button here and go ahead and raise up. Beautiful. So she's still at a 1. This is pretty stable. Go ahead and come back down. It's been like that for months. The last session, her 5th session, was 3 weeks ago, just to give you guys an idea of the spacing here. So 3 weeks ago was her 5th session, and this is really just very stable. If we come down to the bottom one, my index finger's in her belly button. My other 2 fingers lay flat, right where my ring finger comes. That's going to be my 3rd testing spot. Go ahead and come on up. Yeah, this is gone. Okay, so that's a 0. Good. So these 2 are very stable. They've been stable for a while. They're not reversing, because that's always the question your patients and clients are going to ask is it going to flip back on me? It really shouldn't. It really shouldn't, especially after those 4 sessions of treating the jejunal-ileum. If this kind of closes up with that, it's been my experience, it's not opening back up. Obviously, once you close this up with visceral manipulation, you're going to want to start strengthening them, okay? In whichever fashion you want to start strengthening them, please do so. If you don't want to do it, find somebody that can, just so we can re-educate the muscles and give them some strength back. But see if you can approximate them first. So we still have a 1 finger with split here. Again, if you ask physicians, this is not a diastasis anymore. Anything less than 2 finger with split is not a DRA. But, my theory is, why leave that? If we can hopefully, help it close and approximate, that'll help these muscle bellies actually work a little bit better, help her digestion, help any back pain, help core stability, help her pelvic floor and her pelvic organs. So it's just really important to try to bring these back and then to strengthen them, again, with whatever exercises you choose and whatever training you have. So we're going to go ahead and treat D1 again. And so we're going to come up to her xiphoid process right here. We're going to go just inferior to her xiphoid process. And we're going to slide down. So I'm going to sink in, so I'm not just on skin. I'm going to slide these fingers down until I get stopped by a shelf, which is kind of right there. You can kind of see I'm hitting something that is going horizontal on her body like this. This is D1, okay? It's the top of D1. And then if I bring my thumbs in and I sink to the tube and walk over it, it'll feel like garden hose, like a lot of tone, and then I sink into a hole, okay? And that would be D1. Now, before I treat this, I do want to see if she has a listening, but I just kind of want to give you guys an idea of kind of where I'm going as far as anatomy goes. So again, with visceral manipulation through the Brawl Institute, we do a listening, meaning where does the hand pull me? Meaning if something's upset inside the body is going to hug that restriction. Oh yeah, no. She still has a D1 listening. Yep. And so her listening is pretty much right there onto D1, or the first leg of the duodenum. And now if I just listen to that, so again, think of whatever anatomy is upset as like lassoing my hand to it and pulling me to it. And then at the end of that, I just kind of fascia load D1 to see where is it upset? Where does that go to? So if I fascia load into the body a little bit, as I drift off, it goes just inferior. And if I inhibit posterior parietal peritoneum, it comes back, okay? So it's being very specific of where it wants me to treat, which is right there. Okay, so D1 is going to span a little bit of space. So if you have a listening skill under your belt, please use it. So I'm going to be very specific to this spot right here at a pretty good depth. Okay, this is where she's upset with the first leg of the duodenum and the posterior parietal peritoneum. Okay, just right there. Right. So I'm going to come back up, find the xiphoid process again, slide down, find the shelf. There's the shelf. Bring my thumbs to my fingers, feel the garden hose, and there. That's where I want to be until I fall into a hole. Okay, so now I have a tube. Okay, that tube goes all the way up to here. Okay, got it? So it comes all the way up. A lot of times the gallbladder will kind of sit just on top of it here. A lot of times there's an articulation between the D1 and the liver, and sometimes if the gallbladder is removed, there'd be a restriction there. So just give you a little anatomy. This side of D1, this goes into the stomach over here, okay? So these are some issues that we could have. Again, with her, it's more this inferior aspect right under my thumb right here. This thumb right here is where the restriction is, okay? So I'm going to be very specific to that spot. So it's a little bit left of midline, okay? So here I go. I'm going to sink my thumbs and fingers into the body, so posterior towards the table until I feel tension. I'm going to visualize D1, and I'm going to visualize the posterior parietal peritoneum. Okay, they kind of articulate with each other. And I'm going to squeeze the tube in on itself, really focusing on my thumbs. And here she goes. My thumbs are sliding to her left, and my fingers are sliding to her right as I'm squeezing my thumbs and fingers together. Now they just reversed. My thumbs are sliding to her right, and my fingers to her left. And now they're coming back. That's kind of the release for her. And right there, they just stopped. And I relax for a second. Okay. I'm going to keep my space. I'm going to keep my purchase here so I don't lose it. And I'm going to sink in again. Okay, so fingers and thumbs. Sink in until I feel tension. Notice I'm using the side of my fingers and thumbs. Okay, I'm not poking her. That would be very uncomfortable. Again, her restriction is just to the left of midline, so really right where my thumbs are at. I'm being very specific of where that's at. And now I'm going to squeeze the tube in on itself, really visualizing in my mind the posterior parietal peritoneum. And now my thumbs are sliding to her left, my fingers are sliding to her right. This is her release. And now my thumbs are sliding to her right, and my fingers are sliding to left. It's really not my thumbs and fingers that are moving, it's the tissues under them, right? It's the anatomy that's releasing, that's moving my thumbs and fingers. And then it stopped, okay? And again, I relax for a second, keep my position here, and then we'll go in again, okay? So fingers sink in, thumbs sink in, sides of them. Again, a little left of midline. There I am. And now I'm going to kind of compress the tube in on itself, visualizing the posterior parietal peritoneum. And here we go. This is a smaller release. Thumbs going to her right, fingers to the left, and then back to midline, and then it stopped. And I have a pulse now that I didn't have before under my thumbs. That's probably it. Usually with visceral manipulation, we do like 3, but I'm going to try another one just to see if she's got anything else left. That was a really quick release, so chances are that might be it. So we'll try it again. Fingers and thumbs sink in. Again, you're just squeezing the tube in on itself, which engages the posterior parietal peritoneum, which is what I'm thinking is the issue here. There we go. We're going to squeeze the tube in on itself. Yeah, it's not doing anything. Okay, so those 3 were enough, okay? So now I can come back and I can say, all right, do I still get a listing? Do I still get pulled into D1, or the first leg of the duodenum? Is there still a lassoing my hand and pulling me down and saying, hey, I need some treatment here? Because again, your body will hug a restriction. It just will. If you've ever seen an injured animal, it's the same thing. They kind of curl around their injury. We do the same thing on the inside, we just don't always see it. So I don't feel anything. I'm actually fascial loading and trying to get a response here, meaning I'm not pulled into that spot anymore. So what that tells me is her body is saying, hey, you gave me enough to work with here. I'm going to work with it, hopefully release it, and hopefully we'll get rid of this 1 finger width split for her. Now, I don't really know if this is going to happen in this session. It might not. Again, visceral manipulation, you have to educate your patients and clients on this. It takes about 3 weeks for it to really play out. I'm not really attached to what people feel like or if things close up during the session. It's great if it does, but about 3 weeks is what it'll take. Okay, so let's go ahead and check it now that it's there's no listing. And just see what's happening. Okay, so again, ring finger in the belly button. Okay, where my index finger comes, which is interesting, right? You can see the red mark. That's pretty close to where I was working. And then I'm gonna come around like this. And then go ahead and lift your head up for me. Good. So she's still 1, okay? And I'm okay with that, right? It's a very, very, very shallow 1. So here's a muscle belly, right? Here's a little dip, and here's a muscle belly. Okay, so we've got something about that deep, if you guys can see that, about that deep, not very deep at all, and about that wide, okay, and that's it. Okay, so we're going to see what happens with this, and maybe it'll take 3 sessions, I'm not sure. So we'll see if she can come back in 3 weeks, and we'll check it again in 3 weeks.